Hi, I'm Dr. Suvarchala, Scientific Director with ZIVA Group of Fertility Centers. What are the factors that increase the risk of infertility in women? There are many medical causes that cause infertility, but today we are discussing the factors that are responsible for increase in the risk. The factors that are under your control that are unknowingly or knowingly causing your chances of conceiving to decrease. So let us look at those factors. Yes, definitely the most important factor that we need to discuss is age. As age advances, the chances of pregnancy also reduce. This is a very physiological condition. So with age, so around 30s is when it starts. With age, the chromosomal competence of eggs, so as to say the chromosomes inside the eggs are slowly becoming degenerative, as in they're becoming old, they are misforming, they are misaligning, they are not able to function as well as they were when they were younger. So remember that as well. Then there is the factor of number. With age, there is a decline in number also of the eggs. With declining numbers, the ones that are left and the ones that we are going to try fertility with have a lot of chromosomal abnormalities. So in such women who are advanced age, which is around 30-35, we see that even when they conceive, they are prone to a lot of miscarriages. Even if they are not prone to miscarriages and they have a live birth, the chance of an abnormal child also increases with that age. So age definitely plays a very crucial role. The second factor that we need to discuss is smoking. With an increase in westernization in our society, which may be good or bad, there is an increase in smoking in women that we see very often. So smoking causes a very irreparable damage to the ovaries and the eggs. Remember that even if you are young and you are prone to smoking, this harmful effect can be seen on the chromosomal competence of the eggs. So women who smoke and women who don't smoke, these are two groups that were analyzed very extensively, and it was seen that women who smoke have higher chromosomal damages, abnormalities, and are prone to more infertility. Even if they do get pregnant, they are prone to more miscarriages. So this is a very critical point that all women need to understand, whether they are of the age that is lesser than 30 or more than 30. Exposure to tobacco, smoking, the harmful effects also have an effect on the eggs. The third and the most important, I would say one of the most important factors is alcohol. Exposure to alcohol also causes a effect on the the competence of the egg. So such eggs do not have a higher competence for fertilization. The quality of embryos that are formed from such eggs are not good, and they do not have a good implantation potential. So we've seen that women who drink and have had an IVF, for instance, they do not give us good eggs in terms of fertilization and embryo quality. And when we do implant, when we do transfer such embryos, the endometrial quality of such women is also not very good. So the blood supply is not very competent, therefore they are more prone to more recurrent implantation failure, as in many failures of IVF. So it's a very important aspect to remember, because we do the comparison between normal population and also IVF patients. So in normal population also we have seen that excessive alcoholism leads to infertility, and in IVF as well we see the effect on the quality of success rate in such women. Then another very important factor that we are seeing all around us is obesity. So obesity due to hormonal imbalance or obesity due to excessive eating, all these contribute to hormonal imbalance. Remember that the ovaries get these signals, the hormonal signals from the brain. So if it is indisposed, as in if it is surrounded by fat, all these signals are not able to reach your ovaries, not able to initiate the eggs into development. So it does definitely have an effect on your fertility as well. Not only the eggs, it also has an effect on the endometrium, that is the uterus. So these are very critical points that you have to remember, and if you are affected by one of them, if you need help in proper diet and exercise and weight control, you want help if you're advanced stage and you want to conceive soon, please feel free to contact us. Thank you.